What happens when artificial intelligence moves from writing code to designing living viruses? That line just got a lot less theoretical. Welcome to the Automated Daily Top News Edition, the podcast created by generative AI. I'm Trend Teller, and today is August 7th, 2026. Coming up, a striking biotech milestone with real promise and real risk, fresh signs of progress against diabetes and cancer, a growing AI challenge from China, fragile diplomacy in the Middle East, and why supersonic passenger flight may be inching back into view. This episode is brought to you by Stock MVP. Stock MVP helps you invest like the pros using data-driven insights. Find the link in the episode notes. We begin with the most eye-catching science story of the day. Researchers in the United States say AI has now been used to design entirely new virus genomes, which were then built in the lab and shown to work. These were bacteriophages, viruses that infect bacteria rather than people, and the team created 16 that could kill E. coli. Supporters say this could speed up new treatments for antibiotic-resistant infections and push synthetic biology into a new era. But even with safety limits in place, the bigger takeaway is hard to miss. If AI can design simple functional viruses today, the debate over biosafety and misuse is only going to intensify from here. Another medical advance comes from diabetes research, where engineers at Rice University found a way to help transplanted insulin-producing cells survive longer by giving them a kind of local immune shield. Nearby engineered cells released an anti-inflammatory signal called IL-10, creating a protective halo around the implant. In diabetic mice, that helped the cells keep controlling blood sugar for more than 100 days, far longer than unprotected implants. Early results in non-human primates were also encouraging. If this approach eventually works in people, it could make cell-based treatment for type 1 diabetes much more durable without relying on broad immune suppression. Cancer research also brought a cluster of meaningful updates today. One of the most promising is a new effort to prevent colon cancer before it starts in people with Lynch syndrome, an inherited condition that sharply raises cancer risk. Several vaccine programs are now moving ahead, and early data from one candidate showed immune responses and fewer concerning precancerous growths. If that progress holds up, it could become the first real vaccine approach aimed at cancers driven by inherited mutations rather than infections. In a separate cancer story, researchers working on glioblastoma, the deadliest common brain tumor, reported an experimental system that could help in two ways at once. First, by making tiny tumor cells easier to spot during surgery, and then by helping destroy what gets left behind. In mice, the treatment prevented recurrence and dramatically improved survival. It is still very early work, but glioblastoma is notorious for coming back, so anything that improves both detection and cleanup after surgery gets attention quickly. And one more cancer-related development is worth noting. A major UK-led team has built a large biobank of patient-derived cancer organoids, essentially miniature tumor models grown from real patient samples. They use that resource to map thousands of genes that tumors rely on, along with clues about how cancers become resistant to treatment. This matters because better models usually mean better drug targets, and that can help move cancer therapy away from trial and error and closer to something more precise. Staying in healthcare, the FDA has approved a new seasonal mRNA flu vaccine for adults, 50 and older. That is another sign that mRNA technology is settling in as a broader platform, not just a COVID-era tool. The appeal is straightforward. These vaccines can be updated and produced with more flexibility than many traditional approaches. At the same time, researchers are still working through the limits of mRNA, especially when it comes to reducing unwanted immune reactions and making the technology reliable enough for more complex treatments. So this approval is both a milestone and a reminder that the next phase of mRNA medicine is still under construction. On the technology front, Washington is reportedly becoming more uneasy about China's AI progress, especially after Moonshot AI's Kimi chatbot showed performance that may be approaching top American systems. But the bigger issue may not be headline performance at all. Chinese firms are gaining traction by offering open-weight models that are cheaper, easier to adapt, and more available to developers around the world. That strategy is already finding users in emerging markets, and even some interest in the United States. In other words, the race may not be won only by whoever has the most powerful model, but by whoever gets useful AI into the most hands. Now to the Middle East, where two diplomatic tracks could have major global consequences, but both remain fragile. Iran says it is in the final stage of drafting an agreement with Oman over the Strait of Hormuz, and President Trump says a deal may be close. If the shipping lane reopens more fully, that could ease pressure on fuel prices and calm broader market nerves. But the sticking points are significant, especially over who controls access and whether Iran could impose fees. At the same time, Trump is also pressing Israel and Hamas toward the next phase of a Gaza ceasefire framework. Hamas has publicly accepted key parts of a U.S.-backed roadmap that would involve disarmament and a transfer of governance to a technocratic Palestinian administration. That sounds like progress, but the gap between paper and reality is still wide. Israel has not fully signed on, distrust remains deep, and the sequencing of withdrawal versus disarmament is still a central dispute. So, for civilians in Gaza, there is at least a possible path to relief, but not yet anything close to a settled outcome. And finally, a transportation story that feels a little futuristic and a little familiar. Supersonic passenger travel is edging back into the conversation as the FAA considers replacing its long-standing ban on overland supersonic flight with noise-based rules. The central issue is the same one that haunted the Concorde era, sonic booms. Companies and agencies are now pursuing different ways to make those booms less disruptive, with the goal of making faster-than-sound travel acceptable again. If regulators and engineers can solve that one public-facing problem, supersonic commercial flight could move from nostalgia to a real market again. Thanks to our sponsor, Lindy. Lindy is your ultimate AI assistant that proactively manages your inbox, meetings, and calendar, so you can focus on what actually matters. Find the link in the episode notes. That's the top news for August 7th, 2026. From AI-designed viruses to quieter supersonic jets, today's stories were a reminder that big advances rarely arrive without big questions. Thanks for listening to the Automated Daily, Top News Edition. I'm Trend Teller, and I'll be back with the next round of headlines soon.